Hi everyone, I'm Dr. Nupur Khare. I am a internal medicine resident in Germany and I'm currently on a very unexpectedly long break because my maternity leave turned into a sick leave now when I broke my ACL and I just got operated for it 3 weeks back. Um, in the previous video, I talked about the frustrations of just going through the physical therapy, and I promised that I will try to make a little less depressing video. So this is my attempt at that. I wanted to go into the entire situation of being on this side of the table. Like as a doctor, I'm usually on the other side, and I wanted to talk about my experience as a patient this time. I have seen world through this lenses when I had my babies, but that was a little different. And I mean, it was in Germany, and the entire situation was very different. So I think that might warrant another video completely. But right now, with this surgery experience and uh, going through the injury and the diagnosis of the injury and then the surgery and now the post surgery rehab, I think I it has been a lesson in it has been a lesson in empathy, let's say. So I just wanted to discuss how these two sides kind of keep warring with each other. So there is one side which is the patient side, which is full of the anxieties which anybody else would go through, and then there is this side which is of that of very scientific approach and just understanding how medicine works and how the entire how we decide treatment protocols. So knowing that and then still going through this, it has been truly like it I like I already said, it has been a lesson in empathy. So I just wanted to uh, talk about it because I think it has been an interesting experience. The first thing I realized was the abundance of information and how much of a problem it can be. The moment you get injured or you're sick, there is just a bombardment of advice on you. There will be people who are obviously, since I am a doctor and I have colleagues who are also orthopedic surgeons or all have or are physiotherapists or friends, just there are people who have had experience with actual ACL surgeries and who have operated on people, and they are the ones who will give you some advice. Then or also kind of just an idea of how this entire thing is going to be for you. Then there are also people who have been through something similar. So there will be your people who had tears but which were not complete tears. There will be people who went through actually surgery and who will also want to explain or tell you how this experience is going to be for you. And I really found those helpful because it you kind of have a feeling of I think camaraderie, and you have a feeling of like, okay, this I'm not alone, which is why I even decided to do this entire series. And then there are third category of people who have not been through either of those, like who don't have the knowledge or nor have the experience of going through something like this. But since they care so much about you or they love you, and like it's very hard to see it when you are yourself feeling very negative and you're feeling very frustrated. But truly it comes from a place of like, tu sun ab ye mat kariyo, and it's not coming out of anything other than love. But so you that but that is also advice, obviously. So there is just so much of information thrown your way the moment you get injured. And what I as a patient realized was that, I mean, even when you can be very, very rational and divide that these are the people who are experts and I will only listen to experts, the problem with the nature of our branch, the nature of our study is that every expert will have a different opinion. And I have experienced this as a doctor. Obviously there are people who come and say कि पर उस डॉक्टर ने तो मुझे बोला आप ले लो ये दवाई, आप ये वाली क्यों नहीं बोल रहे हो, या फिर उस डॉक्टर ने बोला कि ले लेनी चाहिए. एंड आई हैव माई लाइक रियली डियर फ्रेंड्स हु यूज टू डू दिस टू मी, एंड आई यूज टू गेट रियली फ्रस्ट्रेटेड. इन द बिगिनिंग ऑफ माई करियर आई यूज टू फील ऑलमोस्ट थ्रेटेंड कि क्या तुम मेरी नॉलेज को जज कर रहे हो या तुम क्या कर रहे हो. बट being on this side, as on the patient side, and I now realize it is not that they are judging us. The problem is कि आप सबको रिस्पेक्ट दे रहे हो, यू आर गिविंग द राइट अमाउंट ऑफ रिस्पेक्ट टू योर डॉक्टर्स, बट द प्रॉब्लम इज़ कि पहले डॉक्टर ने जो बोला यू अंडरस्टूड काइंड ऑफ, दूसरे डॉक्टर ने जो बोला इट काइंड ऑफ वेरीज फ्रॉम व्हाट द फर्स्ट वन सेड. क्योंकि एज डॉक्टर्स हमारे खुद के एक्सपीरियंसेस ऑल्सो also influence what advice we give to patients, right? Because कई बार ऐसा होता है कि आप there is one entire thing of course gender, race, the place where you are, the kind of people, the patients you are dealing with will obviously make your protocols differ. उसके ऊपर एक ये भी है कि आपके experiences as a doctor कैसे रहे, like what are the complications that I have faced, like my patients have faced, and how that makes you know. So some doctors are risk averse and some doctors are more risk taking, and both of them are right in their own place because their experience has shaped them. But from a patient's point of view, it is so hard when there are many, like if you, God forbid, have access to more than one expert, it creates so much confusion. And I think the only way I could deal with it was by telling myself, okay, the person who operated on me, he's the God, only everything he says is the only thing which matters. Yet it is still hard because once the operation is over, now we followed his advice that this should get operated, we got operated. Now starts the next part, which is physiotherapy, and in that again there are like different physiotherapists with different level of risk taking nature, I mean, or depending on how much they want to push you, whether they are reading your signs right, because physiotherapy is so much more dependent on your chemistry with your physiotherapist, I feel, because they need to believe that you can take this and you need to believe it as well. So it again creates this confusion of, am I pushing myself too hard or am I not pushing myself too hard at all? And this abundance of opinions is hard. I now have a complete sympathy for patients who have come to me in past and said कि मेरे चाचा की ये दवाई चली थी, वो अच्छी, उससे रिस्पॉन्स हो गया, आप उन डॉक्टर ने ये वाली दी थी और आप. एंड आई थिंक नेक्स्ट टाइम व्हेन आई एम फेस्ड विद दैट आई विल ट्राई टू एक्सप्लेन कि मेरे एक्सपीरियंस में दिस इज़ गुड. एंड आई थिंक दैट इज़ वॉट एवरीबडी, ऐसा नहीं लाइक दिस इज़ वॉट एवरीबडी एंडेड अप डूइंग कि देखो अकॉर्डिंग टू मी आई फील दिस इज़ the right way for you, but you can still dissent. Unfortunately, fortunately, you still have more options. I don't know exactly what is the solution to this, because this is what medicine is. It is not pure science. It's not like जो repeatability in science होती है कि ये experiment हम बार बार करेंगे तो same ही result आएगा. It does not exist for us, and hence we are so much dependent on stats. But stats are again like an imperfect science, let's say, because 82% ये ड्रग काम कर रहा है is a great number, but it also means कि 18% के लिए काम नहीं करेगा, and that is just what medicine is. And I think we as me as somebody who knows all of this finds it so hard to just accept and blindly follow one regime. I don't know how it is for other people जिनको ये trust probably already नहीं है अपने doctors पे, and then उसके ऊपर से there are another doctor saying something else, or not something else बहुत ज़्यादा varied, like the opinions might not be very varied, but they will still be different. It's just how it is. So I think that I have full sympathies for now, and I don't exactly know how medical science is supposed to fix this because creating treatment protocols and following them to the T is also not a great idea because every patient is different, every injury is different, every patient experience is different, and जिस चीज़ में इतना mindset important है, again it's very different. So I don't know how to solve this, but I can just feel the pain of everybody who comes to the clinic with like, अब इन्होंने तो ये बोल दिया, मैं क्या करूँ. Next one is थोड़ा छोटा सा, but I genuinely एक प्रॉब्लम जो मैंने कई बार अपने पेशेंट्स को बोली है, तुमने पहले क्यों नहीं पूछा, तुम पिछली बार आए थे तुमने क्यों नहीं पूछा. एंड नाउ आई नेवर गोना से दिस, क्योंकि द मोमेंट आई एंटर द डॉक्टर्स ऑफिस, व्हेन आई वेंट फॉर माई लास्ट चेकअप, आई वेंट इन विद one night before I had so many things कि अब मैं ये कर पाऊँगी नहीं, I need to ask this question, I need to ask that question. I went inside and he checked me, and then he said all the nice things ki, oh, it looks like everything is fine and now you can do this and this, and I just got so overwhelmed and I forgot to ask everything that I wanted to ask. So sometimes just being in a doctor's clinic, despite being a doctor, despite knowing the doctor, can be so overwhelming. So I now understand that maybe for other patients it's not easy when they don't know kya ho raha hai. Mera solution for this has been that now I am that nerd who takes a copy everywhere, writes her questions down before the appointment, and during the appointment I literally open the book and वो हंसते होते मुझ पे, but it is that soft smile. I know they have accepted कि ये ऐसी है, तो I have question. I have started writing questions for the physiotherapist and also for the doctor. It can be very annoying. I have seen those lists and sometimes it gives me anxiety when I'm the doctor and I see like this giant list of questions. But I think as a patient, it's probably better to do this than forget your questions and go home with a lot of health anxiety. Also, I have started writing down the exercises the physiotherapist tells me, and I am somebody with good memory, but I don't trust my brain anymore. In this situation, I've accepted ki just do things like a student, like how I used to do when I was in school. So I take my notebook with me, I write my questions, I also write the things they tell me. So yeah, that one I think was also very interesting for me, that even I can just enter the clinic and feel like, oh, what was the question again? It's just how it is. And I think this one will be the one for which mere sare colleagues will kill me, but the urge to Google your symptoms. But hear me out. I think it is better that we have this filter of Google and ChatGPT and other AI sources between us and the doctors, because I don't think even the best of my colleagues would be able to deal with me with patients if I started asking them the kind of questions I've asked Google. The only place of like the nuance is that yes, ask your questions. If it helps you, good. If it creates more anxiety for you, maybe stop. Or if it creates more anxiety for you and you have now a bigger question, ask your doctor, and when he or she tells you something, believe it. Don't argue with the doctor कि मैंने ये Google पे पढ़ा था. I think that I will still agree is a trigger for any doctor, I think, क्योंकि the way we study, the way we read, the way we interpret even the same study as anyone else would. I don't know how many people know this, but we literally have a subject which teaches us how to interpret medical data, and it takes an entire year to just understand that. So I think that part of doctors being frustrated with patients who argue with them saying कि पर Google ने मुझे ये बोला like और मैंने ये पढ़ा, and go ahead, ask your questions, ask your queries and gather data. This is my kid obviously who is trying to come in the video. So yeah, Google your questions, है ना Surya? and and ask your questions. You have a right to knowing everything which is going on with you. You have a right to know, to knowledge, and you have a right to knowing all the complications you might go through. But you have to trust your doctor above the whatever internet source you have picked, because medicine is that nuanced that it is very hard to create a perfect formula which will fit everyone, and your doctor knows you. So but let's just say the patient experience has given me a wide amount of patience to deal with the next person who comes into my clinic and says, hey, I read this in Google, I'm sure I have cancer. So yeah. And the last one, I think this one is a very soft note I want to end on. There is one question which every patient asks, and it is such a universal question. Germans ask this, Indians ask this, Indians of all walks of life ask this question. Same with Germans, and like this is my two major data sets. So it's a question which everyone asks and which I just answer as a knee jerk कि ठीक तो हो जाएगा, हाँ ठीक हो जाएगा, और सब ठीक हो जाएगा नहीं, हाँ ठीक हो जाएगा. Till now, that's how I've answered it, that's how I've taken it. It's like a question which is asked and it's just automatically answered. I think now I'm gonna take a minute anytime someone asks this, because it stems and it comes from such deep anxiety. I think anytime you go through a major health issue, I don't even know if this constitutes as a major health issue, but for me it is. Anytime you go through that, there is just this deep urge of just wanting to be normal again. And that's where this question comes from. Will I ever be how I used to be before? And I think now anytime a person will ask me this question, I will take a minute with them and really answer, not just automatically answer. So I think maybe all in all, might be shitty that I went through this, but it might have made me a better doctor, maybe. I don't know. So I'll sign off here, and I'll try to come up with more video ideas which might be interesting. One of the things which I was thinking was like the surgery experience and the first 2 weeks post surgery, how it was. So maybe that's what we'll cover next time. Till then, bye bye. Do you want to say bye? No. No, I don't say bye bye. Bye bye bye.